Welcome to Week 3 of Death 101. This week, you will learn the importance of non-communicable diseases, NCDs as they are called. NCDs are particularly important as child death rates decline and as particular risk factors, most notably smoking, increase. The week is structured as follows. First, you'll get an introductory discussion on the causation of chronic diseases by Sir Richard Peto, one of the most eminent epidemiologists in the world today. Causation of chronic diseases is in some ways quite different than, let's say, malaria causing a death from malaria. That's directly related to the infection. For adults and for chronic diseases, causation is slightly different in that multiple factors can increase the likelihood of that person dying from, let's say, a heart attack. Think of a person who's got high blood pressure and is diabetic and has other risk factors. Then we'll go on to cover smoking as a big, important risk factor worldwide, discuss in particular alcohol and binge patterns of alcohol, looking closely at what happened in Russia. And then we'll turn to specific diseases, cancer, and examining how to prevent, treat, and palliate cancers. And then finally, vascular disease, which is the leading causes of death worldwide. This week will complement what you learned in Week 2, which was on infectious diseases and childhood conditions, by focusing particularly on the chronic diseases of adults. Enjoy the week.
What cause means in epidemiology, if you say that something is a cause of, say, lung cancer, it means that among otherwise similar people of the same age, the smokers are going to be more likely to get lung cancer in the near future than the non-smokers. So it's increased probability among otherwise similar people of the same age. It is the appropriate way to think about causality when you're talking about the main avoidable causes of non-communicable disease. The avoidable causes, the important causes, are those that make the disease more probable among otherwise similar people of the same age. It's a perfectly reasonable concept, and just people muddle themselves up. One little trick which helps to avoid confusion is never talk about anything as being the cause of lung cancer. Always say that it is a cause of lung cancer. Smoking is a cause of, well, about 90% of the lung cancer deaths in Britain and America at the time, nowadays. But you can have two causes of one death. For example, there was a horrible accident in the shipyards during World War II, where they used asbestos to insulate pipes. They didn't realize what the hazards were. And so the workers were putting insulation on the pipes as they were building ships, and they were getting exposed to asbestos dust, and they got so much dust in their lungs that it made lung cancer about 10 times more likely, just as smoking does. But of those men, many of them smoked, and the smoking made lung cancer 10 times as likely as well. So if you both smoked and got exposed to asbestos in the shipyards, then you were 100 times as likely to get lung cancer as somebody who'd never smoked and never got exposed to asbestos. So if you take somebody with no asbestos and no cigarettes, then a shipyard worker who smoked would have 100 times the lung cancer risk. So among 60-year-olds, you'd finish up with 100 times the risk of getting lung cancer in the near future, compared with a 60-year-old who'd never smoked and never had asbestos exposure. Now, so you take 100 smokers who who worked in asbestos yards and got lung cancer. Of those 100 lung cancers, 90 wouldn't have happened if they hadn't smoked. Of those 100 lung cancers, 90 wouldn't have happened if they hadn't had the asbestos exposure. So smoking is a cause of 90 of those 100 deaths. Asbestos is a cause of 90 of those 100 deaths. And that's not at all paradoxical. It just means that you shouldn't talk about things as being the cause, because the word the suggests that it's that and not anything else. Whereas when you stress that it's a cause, it's much better. Another example, if you take cervix cancer, people claim that cancer of the cervix, that every case of cancer of the cervix arises in a woman who's been infected with a cancer-causing papillomavirus, some type of human papillomavirus. Now, I don't know if that's true, but even if every cervix cancer case has human papillomavirus as a cause of it, it's still better to say that human papillomavirus is a cause of all cervix cancer cases, because there might be other causes. It might be, for example, in fact there's some evidence to suggest that it is, that among women who've got human papillomavirus infection, smoking makes them twice as likely to get cervix cancer. Now, if that's true, and if that's a cause and effect relationship, then HPV is a cause of all cases of cervical cancer, and smoking in those populations would be a cause of half of all the cases of cervical cancer. No paradox at all. So always talk about a cause of something, and don't expect, when you understand all the causes, the attributed causes, the attributable fractions to add up to 100%. They'll add up to well over 100%. And don't ever ask whether, what fraction of cancers are caused by genetic factors and what proportion are caused by environmental factors. I mean, it's just not, they're not mutually exclusive.